Help for saggy, crepey neck. I had CO2 laser 3 weeks ago, then Botox for forehead, and Juvederm for parentheses and jowls. I didn't have anything done to my neck, and I wish I had at least tried, because what good is it for you to look better when your neck is awful? So outside of a neck lift, would anything help?
Thank you for your question. You submitted several photos and you stated in your question that you underwent CO2 laser as well as Botox and some Juvederm for your parentheses lines and your jowls. And now you're focused on your neck and you're making an interesting observation that what's the point of having improvements in those areas while the neck appears to be saggy or as you described, having crepey skin. And you want to do something that doesn't involve a neck lift. Well, I can certainly give you some ideas of how I approach my patients in my practice in a similar situation as yourself. A little bit of background. I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and helping people with facial aging is the real core of my practice and my daily practice. So certainly the challenge is, of course, an ongoing challenge for someone like yourself, where you start to do things for certain areas that draw your attention, and then you start to look at other areas. And this is very typical. You know, we have so many options these days that it is not unusual that once we look at the hierarchy or the priorities of a patient's needs, once one thing gets taken care of, or two things or three things, then basically you get another perspective on your overall appearance. Now, that being said, I think it's important to first recognize the anatomic issues and then the possible options that are alternatives to the surgical option of neck lifting. So to begin with, let's look at what you describe. When you look at your photos, you see the facial sagginess along the jawline that is responsible for that jowl and the amount of skin that's under the neck. Now, if you were to do what is often referred to as the mirror lift, where you lift everything and you look in the mirror and you like what you see, you understand that the major issue is relative descent or change of position of the soft tissue of the face. And so it's in both the facial element to the neck skin as well as the sagging of the neck skin. And when as a surgeon and someone who provides comprehensive solutions in my practice, everything from surgery to volume augmentation, fillers, non-surgical procedures, as well as lasers and energy-based devices, essentially I customize the program for every patient based on what their desires are and an understanding as what the outcomes will be for every procedure. So, that being said, I would say that the most ideal procedure for you in dealing with the descent of facial skin and neck is a procedure like a surgical face and neck lift. Now, surgical face and neck lift is based on the principle of repositioning tissue that has sagged. So, in a face and neck lift, in a surgical approach, everything is being lifted. Now, you've just had two procedures which address the other elements that we approach. The other elements are volume loss, and that's where Juvederm played a nice role, or the injectable fillers play a nice role in restoring some volume in areas where there's volume loss. And then skin texture and quality, and that's where the CO2 laser was a value for you. So, if you don't want to undergo a surgical procedure, for whatever reasons, whether it's, and for a lot of our patients, there's a timing issue where they want to do it, but they need to do something for an upcoming event, like a wedding or something special, and they want to do something that doesn't have anything close to the downtime. And the downtime for a face and neck lift surgery is about a week to 10 days. So it's not exactly that inconvenient, but if you don't have that time, then, or if you don't want to have surgery, period, I'll share with you some of the options I've offered our patients. When you're dealing with this sagging tissue and you're willing to accept a certain compromise, and that's very, very important. If you're willing to accept a compromise, you can't get neck lift results without a neck lift. As many devices and concepts are all around us that claim to be alternatives, they're not necessarily alternatives, but they're really, I think, complementary to the procedures that are more definitive. Now, they're alternatives if a patient is willing to accept an improvement to a certain level beyond which they can't achieve without surgery. And this is about making an informed decision. So, for a patient like yourself, I actually have offered procedures such as suture suspension neck lifting, and this is a procedure where we're basically using the same principles of what we do in surgery, such as suturing and lifting and tying muscles to tighten the tissue, and then overlapping the skin and then trimming the skin. In this procedure, we're basically passing the sutures through the skin without opening the skin. So it's kind of a blended procedure. And what are we doing? I'm basically supporting the muscles and helping define the neck. I'm not removing skin, but unlike a surgery, basically it's a little local anesthetic and then passing of sutures in a strategic way. Now, this is not a thread lift. A thread lift is a very different procedure where they're using where what's called barbed sutures are used to try to lift the skin. And from my experience, for someone like yourself, a thread lift won't be very effective. However, suture suspension does have a potential role in your situation. Now, the other side of that, from the external approach, the skin quality, texture, and tone approach, there are options such as thermal energy devices or energy-based devices, as well as in our practice we use a laser that basically heats the skin and causes skin tissue contraction, but it does not ablate or take away the top layers of skin like your CO2 laser experience. This is based on the concept of delivering thermal energy to the deeper tissues to cause some tightening and remodeling of the skin. Now, one can argue that it depends a lot on the capacity of the skin to generate collagen, and that's absolutely a limitation. And it requires several sessions in order to achieve a result. So there's a time investment as well involved, but it is an alternative. So the way I approach something like this is basically suture suspension to bring the skin up, the tissue up, and then energy-based device to shrink wrap the skin and to improve skin texture and quality. It's an option, it's an alternative, but as a surgeon I would say that if you want to get really the results that you probably really ultimately want, then surgery is worth considering. In our practice, we do face and neck lifting surgery under local anesthesia with light sedation, which means basically you're avoiding general anesthesia, which is often a disincentive for many patients. They don't want to have a tube in their throat. They don't want to be put under general anesthesia. And doing it under local with sedation, we're also able to expedite recovery. And so in practice for over 20 years and developing my style, I've been able to get people back to work in a more expedited way. So although there are alternatives, I think you shouldn't close the door completely on the option of surgery. I found, especially in the early to mid 2000s, when there was a rising popularity of short scar procedures, short scar lifts, people wanted the results of more extended face and neck lifts. And although they would say that they would be willing to compromise with the results, even though there was improvement, they always wanted a little bit more. So it was just kind of a basic understanding that, yes, improvement is possible, and as long as you and your doctor communicate effectively, then you can come to a compromise and get a result that might be a bridge before you do a more definitive surgery. So I hope that was helpful. I wish you the best of luck, and thank you for your question.